Welcome to the first in our series of webinars on animal health. Today we are covering equine parasites in horse worm control, learn a new approach. My name is Ben Watson. I'm one of the directors of hyperdrug.co.uk, a leading supplier of health advice and products in the UK. I've been joined by Wendy Talbot, who is a vet and the National Equine Veterinary Manager for Zoetis. We'll try to answer any questions, but we may not have time, so we endeavour to publish an FAQ after the event. At Hyperdrug, we've been trading since 1828, online since 1998, and we're a family business. If you're one of our customers, you'll know that we keep full patient records of your medication and individually tailor advice for both new and existing customers. We also do fecal worm egg counts in-house, and we have pharmacists, microbiologists, and suitably qualified persons on hand to give advice. Here are the results for the worm egg count poll. As you can see, 52% said yes, you did fecal worm egg counts. Worm egg counts are very important for worming strategy, and we'll be covering this in more detail shortly. We will also have a quick poll at the end of the webinar, and it will be interesting to see if your worm control strategy has changed. Here are the results of the encysted small redworm poll. We asked you if you treat for encysted small redworm in late autumn or over the winter, and 88% of you said yes, while 12% of you said no. This is the single most important worm that needs to be treated and can lead to horses dying, and we'll cover this in more detail shortly. Okay, I'm going to pass you over to Wendy.
Okay, Ben?
Yep, I can see your screen fine.
Okay, thank you. Firstly, I'm delighted to be able to be invited and to speak on this topic, which is very important and very close to my heart. So I hope that I can give you a good overview of worm control in horses and what we should be aiming for in today's environment. For you as horse owners, I think there's a minefield of information which can potentially be confusing. And this presentation aims to explain which parasites affect horses and the principles behind developing a worming control program. So why do we need to worm horses at all? Well, in the wild, horses have evolved with parasites and they establish a balance which allows both to survive with each other. Horses in that environment will naturally move onto a larger area and onto cleaner pasture, which allows them to graze and for the pasture to recover. In addition, other species such as cattle also graze the areas, and this can have a cleaning effect for the equine parasites. In domesticating horses, we've ruined part of this balance, which means that the parasites can sometimes build up into very large numbers, which can threaten the health of our horses. Much has changed since the worming recommendations were first introduced around 40 years ago. At that time, worming was based on dosing at frequent and regular intervals throughout the year based on how long we expected the wormer to work for. This approach was called routine dosing, and all horses were dosed at the same time regardless of their worm burden. So what are we actually trying to control? Well, routine dosing was designed specifically to control a parasite called the large redworm. The approach was highly successful, and as a result, the large redworm is now very uncommon in today's domestic animals. Unfortunately, using this approach is not so applicable to the types of parasite which occur more commonly in today's environment on horses. And because of that, the many worming protocols that we have will routinely fail to control those parasite populations. So one of the reasons that routine dosing is not working as well is because it's the type of parasites that have changed, and the main threat is now the small rather than the large redworm. Small redworms have a very different life cycle and behaviour to the large redworms, and therefore the approach that we need to control them is very different. To understand how best to worm your horse, it is important to first know which type of parasites we are aiming to protect them from. Broadly speaking, they fall into three main groups. The roundworms are a group which have the most classic worm type appearance, being long and cylindrical in structure. This group includes the large and the small redworm already mentioned, mentioned, and 2 other common parasites, the pinworms and the large roundworms. Large roundworms almost exclusively affect horses less than 18 months old, and they are one of the most important parasites to consider in this group. Next are the tapeworms, and these are much flatter in appearance and are an important consideration in any worming program. The third group, the bots, are actually the larvae of a fly rather than a worm, but they are included because they are an internal parasite of horses which do require attention in a worming program. Each parasite has a common name, shown here in red, and also a proper name, which you may sometimes hear being described. So I think it is useful to quickly compare the names that may be used. Small redworms are also known as small strongyles or cyathistomins. Large redworm are also large strongyles or Strongylis vulgaris. The pinworms are known as Oxyurus equi, and large roundworm are otherwise known as Parascaris equorum. Tapeworms and bots are usually referred to by their common name, but their proper names are Anoplocephalus species and, for the bots, Gastrophilus species. During this presentation, to avoid confusion, I will mostly refer to the parasites using their common names, such as small and large redworm. So I will now describe the most common parasites that we find in adult horses and how their behaviour can affect our decisions in our worming control program. The small redworm is the most important parasite which we need to identify and deal with. This parasite is extremely common, and virtually all grazing horses are exposed to them at some stage in their life. If they are seen in the droppings, they are easy to identify, being small and red in colour. However, if they're not seen, rather like fleas on a dog, it does not necessarily mean that the horse is not affected. These worms can vary greatly in how long it takes them to pass through the horse. In ideal conditions, it can take as short a time as 5 weeks, but in some circumstances, it can take much longer, up to around 2 years. So having a basic understanding of the life cycle of a parasite is fundamental to being able to understand how best we can effectively kill these parasites. The small redworm has stages of its life cycle that develop in the horse, shown here in brown, and those that develop on the pasture, shown in green. To continue to affect the horse, the parasite needs to complete all of these stages. If we can disrupt any of these stages by whatever means, we can help to reduce the worm burden. The cycle starts with the eggs being passed in the droppings of horses onto the pasture. Once on the pasture, the egg then needs to hatch, and larvae emerge that must go through 3 different stages on the pasture before they are able to reinfect the horse. These stages are very dependent on certain weather conditions, with the optimal conditions being warm and wet weather, typical of that found in spring and often summer months. Once the larvae have developed, they can then infect the horse whilst the horse is grazing. They are then swallowed and then pass through the stomach and on into the small, then the large intestine. Once in the large intestine, the larvae will burrow into the inner lining of the gut itself and continue to develop in small cyst-like structures. This process is often a continual development. However, sometimes the larvae can stop developing and enter a sort of hibernating state where they are known as encysted small redworm. After a period of time, the larvae will then emerge from their cysts into the lumen of the gut again, where they finish their development into egg-laying adults, and the cycle starts again. So worms are very important because they can cause disease and they lay eggs, which then go on to contaminate the pasture and reinfect our horses. However, of equal importance are the larval stages of this parasite. During the time when they are encysted, the larvae cause damage to the gut wall, and because they are hidden, they are not treated by all types of wormers. Encysted small redworm most commonly occurs during the winter period when conditions are not favourable for eggs to survive on the pasture. Treatment is aimed at stopping these larvae from hibernating or killing them as soon as possible after they have, and for this reason treatment specifically targeted at the encysted larval stages is recommended in late autumn or the early winter. In some circumstances, such as when a larval burden has been demonstrated, it may be necessary to advisable or to treat again in early spring. So untreated or heavy burdens of encysted small redworm can lead to poor condition over the winter period, or more seriously, a condition known as larval cyathistominosis. This condition occurs when there's a large number of larvae that all emerge from the gut wall at the same time, causing damage and inflammation to the intestine. Somewhat ironically, this can occur after a worming treatment, but especially if that wormer doesn't specifically target the larval stages of the parasite. So what are the signs of larval cyathistominosis? Well, they include a severe and watery diarrhea, and that usually develops rapidly over a few days. There is often colic, and the horse is dull and depressed and very reluctant to move. In the early stages, they may continue to eat, but this is replaced with a lack of appetite in the later stages of the process. Typically, there is a rapid and severe weight loss over only a few weeks. Cyathistominosis is very common in the late winter or early spring, and it is thought that it's due to the weather conditions and the environment becoming more favourable, therefore encouraging the larvae to develop into egg-laying adults. There's a strong tendency for this condition to occur in animals that are under 5 years old, although it can affect animals of any age. Tragically, once symptoms are established, it has been reported that up to 50% of affected horses will not be able to be saved, and that's something we clearly want to be able to prevent. It's therefore essential that we aim to treat the encysted stages and prevent symptoms from developing before they start. So, the small redworm and its encysted stages are one of the main reasons why we need a new approach to planning a worm control program. But in addition to the worms themselves changing, it's also getting harder and harder for the wormers that we have available to control them. In the same way as bacteria are developing resistance to many antibiotics, the worms have the ability to become resistant to the worming drugs that we have to treat them. This happens because the worms that survive any given treatment are the ones that then go on and breed, and it's those that then pass on their genes to the next generation of parasites. If we continue to use the wormers indiscriminately in any animal at any time, then we're more likely to encounter this drug resistance. We must therefore develop a worming program which will protect horses from clinical disease without putting so much pressure on the worm population that resistance develops. This means that overall we develop new principles and new guidelines for when a wormer should be advised. Because resistance develops within populations of worms, in other words on a yard or a field, it means that all of us are directly affected, and we need to take steps to protect our own horses. It's not just an altruistic venture for the greater good. It really does affect each of us individually and each of our horses. In the latter part of the webinar, I will go through how we can work with your prescriber to protect your horses in the short and long term with a specific program tailored to them. So small redworms are important, but we also mustn't forget the other important parasites. Tapeworm have been reported to be present in up to 69% of horses in the UK. They have a segmented body which can range from 4 centimetres to even around 80 centimetres in length. All horses are at risk of infection, but most at risk are those that are less than 5 years of age. In a similar way to the small redworms, as horses get older, they develop a type of immunity to these parasites and become more tolerant to their effect. The tapeworms live at the junction of the small and large intestine, and this part is naturally quite narrow in the horse. So large burdens of tapeworm can cause impactions where they block the intestine. They can also cause spasmodic colic, where the gut is trying to get rid of the tapeworm and trying to clear the gut of the infection. Another type of condition is intussusception, where the gut is pushing so hard to get rid of these tapeworm that part of it gets sucked into another part of the gut and cuts off the blood supply, resulting in a really nasty and horrible type of colic. The bots are a third type of parasite to consider, and as mentioned, these aren't a type of worm, these are actually larval stages of the bot fly. The adult fly itself lives for only a few weeks at the end of the summer, just as the nights are starting to chill and getting a little bit more colder in the air, so around sort of September, August time. These flies lay their eggs on the legs and body of the horses, where they can easily be identified as these bright yellow and quite sticky sort of eggs on the horse's body. The eggs themselves are mildly irritating to the skin, and because of that the horse will lick them off as they're grooming, and the larvae then burrow into the lining of the mouth. Sometimes this can cause really obvious type of sores in the horse's mouth, which can really be quite alarming to the horse owner if you see them, but don't really cause the horse a massive degree of distress or discomfort. Once they've done this, they then migrate to the throat where they're swallowed, and the rest of the life cycle takes place in the stomach, where if left untreated, they can develop into quite a large population of bot larvae. It's generally now recognised that some bot larvae are not dangerous to the horse. However, if very large burdens develop, this can easily be associated with a large number in the stomach and have some stomach and mild irritation symptoms. It's therefore recommended that they are considered along with other parasites during a worming control program. But in today's environment, they rarely need specific intensive therapy of their own. So, we now know the most important parasites that we're aiming to control in adult horses. But how does this pull together so that we can effectively achieve the control whilst at the same time preventing the development of wormer resistance? A useful way to think about the program is to break it down into 4 distinct stages. The first stage is to manage the pasture to minimise reinfection. The second is to test regularly to give an idea of worm burdens. Third is to use these to plan a worm control program. And fourth is then, only after all of this, to dose with the right wormer at the right time for the right parasite. The concept of pasture management is not new, but it's arguably the most important stage, and therefore I make no apologies in going over the pasture management again. If there are more worm eggs and larvae on the pasture, it's not rocket science. that it's more likely that the horse is going to eat them and consequently have more worms inside. Therefore, anything that you can do to reduce this challenge on your own fields will have a direct effect on the challenge that your specific horse is likely to come across. So how can we do this? Well, once the eggs pass in the droppings, they then hatch into larval stages, which then migrate onto the forage. This effect does not occur to any great degree in stables because the environment is not favourable enough for the larvae to develop. So really we're talking about picking up the droppings on the pasture. Removing the droppings is otherwise known as poo picking, and it's a tried and tested way of reducing the number of infected larvae which are able to develop. Daily removal is ideal, not least because it stops it becoming such a large job over the weekend. We all know that feeling when you go out and you just have barrow loads of muck to shift at the weekend. You'll be happy to know that studies have shown that even twice weekly removal can dramatically reduce the number of larvae on the pasture, and further that this then goes and reduces the number of eggs that are shed by the horse. So twice weekly removal can be effective and has been shown to be effective, but if you can, removing them daily, particularly during the summer period, is advised. Other ways of doing this can be to try and graze them with other species. Cattle and sheep aren't routinely affected by the types of parasite that affect horses, although there are some specific exceptions, and these can then be effectively used to clear the pasture by co-grazing them with horses in a similar way to the situation in the wild. Resting the pasture can be very helpful. The obvious question there is, how long do I need to rest the pasture for? And this can be really very dependent on the environment, how favourable the conditions are for development of the larvae and the eggs. And this can be quite a big sort of concern as to, have I rested it for long enough? And it's very difficult to be able to answer that question. As a rough guide, if you're relying only on resting the pasture and not clearing up the droppings at the same time, really horses should be moved at least every 2 to 3 months, and then that pasture rested until the following year, so not grazed again in the same worming season. This is more effective if you combine it with harrowing, but again be aware that if you harrow the pasture, if you don't rest it for long enough, all this really has the effect of is to spread the worms across the pasture more and to make them more available to the horses to eat. So useful method, but not applicable to many people because they don't have enough pasture to be able to rest it for long enough. Similarly, it's important not to overstack paddocks. As a rough rule of thumb, then using one horse for every 1 to 2 acres is quite a good measurement of what's overstocking, of what's acceptable stocking. This does depend, of course, on the quality of the grazing, the type of horses, and again, how often the pasture is cleaned. As an alternative, actually reducing the pasture size, which can seem a little bit the wrong way round, can have the effect that you're actually able to clean that pasture more effectively on a more regular basis, rather than if you're using a large pasture for a large number of horses at any one time, it becomes then very difficult to effectively remove the challenge. So we've talked about pasture management. There are also some tests that can give us a useful indication as to whether your horse has a significant worm burden or not, and therefore if you need to treat. The fecal worm egg count uses a small sample of droppings to assess the number of eggs that are present. This is often reported as number of eggs per gram, and this can be used by your prescriber to advise when a worming treatment should or should not be given. The tapeworm antibody test traditionally used a sample of blood taken by your vet to analyse the level of antibodies produced by your horse in response to tapeworm infection. More recently, a test based on a saliva swab sample has been made available. Regular fecal worm egg counts are now a universally recognised method of monitoring the parasite status of an individual horse and a herd over time. Measuring the number of eggs passed or shed gives an indication of the worm burden inside the horse, although there is not a direct and absolute correlation. So, for example, a horse with 400 eggs per gram does not necessarily have more worms than one that's passing 500 eggs per gram. These worms in that horse may just be producing more eggs at one particular time. Perhaps more importantly, fecal worm egg counts will indicate which horses are shedding the most eggs and therefore which animals are contributing the most pasture contamination. Interestingly, in any group of horses, only approximately 20% of them will contribute around 80% of the eggs passed onto the pasture. Those horses that are shedding the most are known as high shedders, and you might come across this term quite frequently, with others being classed as medium or low shedders accordingly. Once horses reach about 5 years of age, studies have shown that they tend to stay quite consistent in which category they are, i.e. as to whether they are a low or medium or high egg shedder. Whereas younger animals will quite often change their status quite frequently between samples, and because of this they often need special consideration in a worming program. Another useful application of the fecal worm egg count is to take a sample before and after using a particular wormer, and this can be used to calculate the effectiveness of that wormer in your particular horse and your particular population. And that's a useful thing that can be done. Like all tests, the fecal worm egg count is only an indication of what is happening at one particular time. So it's known as a snapshot in time. And there are some points to remember, which is important when we're interpreting this test. Firstly, the eggs might not be uniformly distributed throughout the droppings. There may be one point that has more eggs than others, and you may not happen to pick up that particular bit of the dropping. For that reason, when you're collecting a sample, it's advisable to take a small amount from a number of different sites in the droppings pile and then mix these together to try and give as representative sample as possible. Secondly, the worms themselves may lay more eggs at certain times of the day, or in certain horses, the worms may be more productive with eggs than others. So it gives an indication, but there are also other periods, such as during the winter, when the adults aren't producing large number of eggs, there aren't that many adults there, or they're just not producing the eggs. And this particular time is when the larval stages are most common. Because of this, the fecal worm egg count is not as reliable during the winter period as it is during the spring and summer months, because they may come back with a negative or low count despite there being large number of larval stages. Taking all these considerations together, the fecal worm egg count is a very useful tool, but it gives the most valuable information when they're used to give serial measurements over time. The best time to do counts are during what is traditionally called the grazing season, and that's the spring, summer and early autumn period. As a guide, worm egg counts at 8 to 12 weekly intervals, so every 2 to 3 months, throughout the grazing season, will usually effectively monitor egg shedding in a population. Thinking about the tapeworm test, tapeworms do not produce eggs all of the time in a consistent fashion, and therefore the fecal worm egg count is not a reliable way of diagnosing tapeworm infection. The most commonly used method of diagnosis used over the last 5 years or so is the tapeworm antibody test using a blood sample. When horses are exposed to tapeworm, rather like other infections, they produce antibodies as a defense, which can be measured in the blood. The antibodies can be measured and they give an indication of previous exposure to the parasite, but interpretation of the test requires some caution because antibody levels can take a number of months to fall following exposure to the parasite. This means that if you have a positive test, that may only indicate previous exposure and not active infection with tapeworm, particularly if they've been treated with a wormer effective against tapeworm in the last 6 months. Following on from our good pasture management and testing, we can then use this information to build an effective plan. Traditionally, worming was performed at the same time with the same product for all horses on the yard. Using the information from the previous slides, you can see that using this approach, some horses would be wormed when it was not strictly necessary, i.e. when they have a low worm egg count, or that some horses may require extra worming treatments because, for example, they're high shedders, they're higher risk, or they're developing and contaminating the pasture more than other horses. The aim, therefore, is to build a specific plan for each horse based on their individual need. This is perhaps a good time to remind you that you are not expected to devise and implement this plan on your own. Wormers are prescription-only medicines, and as such they need to be prescribed by either a vet, a pharmacist or an SQP. Each of these professionals are trained to take into account all of the circumstances that affect your individual yard and your individual horse. And using all of this information, they can then prescribe the most effective product to meet your needs. There is no one product which is suitable for all horses at all times in all situations. You should ask your prescriber to work with you to build a specific plan and to review that plan annually or before that if circumstances change. New advertising regulations prevent advertising of worming brands directly to horse owners, and that means it's more important than ever to discuss which is the most suitable product for your horse with your prescriber. So what issues will the prescriber and yourself have to take into account when considering whether worming is necessary and what type of parasite we're going to worm against? Well, there are many issues that can affect the worm burden, and your prescriber will consider the history of the horse and its environment. So, for example, is it a new horse? Has it been out with other animals? Were they wormed? Were egg counts performed? Is there a history of disease on that yard? The age can be hugely influential, as young animals can suffer from different parasites and be more prone to significant infections. Conversely, an older horse, which is unable to gain condition, may well be immune compromised and also require special consideration in the worming program. In addition, some parasites, such as encysted small redworm, are much more common at certain times of the year, and this must also be taken into account. This chart gives a useful summary of the main threats to adult horses by season of the year. So what it doesn't do is say that at each of these times you should give a wormer for every parasite to every horse. What it does do is tell you which parasites you should be considering at which time of the year and whether or not your horse needs dosing for that particular parasite. Looking at spring, the redworms are starting to emerge and are increasing in number. So as the weather gets better, they're more favourable for the life cycle to continue on the pasture. They become much more of a threat throughout the spring and summer months. Taking a fecal worm egg count at this time, as early as February or March, can give you a really good indication from the start of the year as to what type of burden that horse is carrying, how much it's contributing to the pasture, and whether or not it requires worming at the start of the season. Also at this time, the tapeworm should be considered, and it's common to worm for tapeworm at this time of year. Throughout the summer, by far the biggest threat to our adult horses is the redworm, the small redworm in particular. So they're cycling on the pasture, they're continuing their life cycle over about 5 to 6 weeks, and if they're not kept in check and the pasture isn't controlled, then burdens can develop very rapidly. The best way to monitor these is to perform the serial worm egg counts, which I mentioned previously, and this will give an indication as to which horses need treating and which don't. And there's a bit more on specifically which to treat and which to not later in the later slides. In autumn, redworm may still be cycling, but they also may start to encyst, so they might start to take cover in the gut wall at this time. An encysted small redworm dose can be added as early as this time, so sort of the October-November period, or we may want to delay it until a little bit later, November or December. And this can often be determined by weather conditions. If the weather is much more mild and wet, the worms are less likely to start to hibernate early on, and the dose is better left until sort of November, December time. Traditionally, the second tapeworm dose of the year is given during the autumn to remove any infection gained over the grazing period. In winter, we may need to treat for encysted small redworm if that hasn't already been done, or if there is a specific threat. Redworms are still there, but not cycling in the same way. And at the end of the autumn period, we want to treat for bots as well. So a lot to think about at different times of the year. And how can we develop this into a plan which can be adapted for your horse, for your circumstances? So the approach is called selective therapy because it selects horses which need to be treated at each worming time. So think about those 4 segments that you saw, and those which should not require treatment at every time. Selective therapy is usually only considered to be suitable for adult horses, so those that are over 3 years old in this context. I will talk about foals and weaning separately in the next slide, and I think that generally speaking, there's quite a lack of information available or readily available about foals and yearlings, so I hope to be able to give you some insight and some sort of hard guidelines as to what you should be aiming for. So selective therapy is probably best thought of in 2 parts. First, add in the minimal requirement treatments per year. Because it can be difficult to distinguish between active and old tapeworm infection, the accepted way for dealing with tapeworm is to dose twice yearly. In contrast to the small redworm, there is very little suspected resistance in tapeworm, meaning that dosing twice yearly is still a safe and recommended approach. Dosing at the beginning and the end of the grazing season, so in spring and autumn, helps to disrupt the 6-monthly cycle of the parasite. Remember, not all products treat tapeworms, and they will require a specific type of wormer, either on its own or in combination with a broad spectrum worming product. Your prescriber will be able to advise you on which products are suitable for this purpose. Next, a specific dose for encysted small redworm should be added during the late autumn and early winter period. This can sometimes be achieved using a wormer that also treats tapeworm, so therefore helping to reduce the number of doses, total doses required throughout the year. In addition, during this late autumn period, we should also be thinking about a wormer which is effective for bots as well. So we start with those, we can combine them so that those combine into 2 treatments, one in spring and one in the late autumn period. The second part of selective therapy is to add in our fecal worm egg counts. So counts should be started from approximately the beginning of March or earlier if there's a specific worry or concern, and continued right the way through into sort of the October-November period. Currently, many people use a cutoff of approximately 200 eggs per gram as a level of shedding that indicates a need for a worming dose for small redworm. As always, the answer is not black and white, and all of the history and all of the clinical information available should be taken into account. So, for example, a younger horse may need treating at a lower worm egg count, and an older horse may be able to tolerate a higher worm egg count. Once we use this approach, so using the fecal worm egg counts every 2 to 3 months through the grazing season in a regular fashion, then many adult horses will only need to be wormed 2 to 3 times in the year, which is probably a significant reduction in the number of worming doses that many of us have been used to. It's important to realise that this approach is only suitable if you are doing all of the testing and keeping on top of knowing what worm burden is there and whether your wormer is effective. Foals differ from adult horses in that the main parasite threat includes the potentially fatal large red roundworm, and around 6 months of age the main threat will then gradually shift to include small redworms, although the exact timing can be quite different in different populations and different animals. A fecal worm egg count can be very useful to identify which parasites are present in your particular foal and which treatment is most suitable. Because foals are most susceptible to the effects of parasites, and because they change their egg shedding status more frequently, a selective therapy approach is usually not recommended. So this means instead of aiming for 2 to 3 worming treatments per year and then worming on top of that based on a need demonstrated by fecal worm egg counts, for foals we aim to start worming at around 2 to 3 months of age, and then that's continued at regular intervals throughout the first year of life, so that around 4 to 6 worming doses are aimed for in the first year. Practically speaking, this can often be broken right down to 2 to 3 months for the first dose, dose again at 6 months, dose again at 9 months, and then again at 12 months of age. Again, it's very important to work with your prescriber who can assess the most likely threat to your foal and then prescribe the one that's most suitable for your foal at the most suitable time. Similarly, weanlings and young stock are more susceptible to the effect of worms than their adult counterparts, and they often contribute the most to eggs shed on the pasture. Where possible, because they act as these almost egg factories, if you like, it's often advisable to keep the young stock separate from the rest of the herd where possible. Again, aim for approximately 4 yearly treatments, remembering to treat for tapeworm twice yearly and encysted small redworm at least once in the autumn or early winter period. Out of all of the groups, these are the ones that are most likely to require a second encysted small redworm dose at the end of the winter or beginning of the spring period. And that's because they're most susceptible to this condition. Go back to the slides on the encysted small redworm. They're much more likely to develop severe disease. They're much more susceptible to their threats. You should speak to your prescriber, so your vet, your SQP or your pharmacist, and they can assess if this is required for your animal. Despite aiming to treat for these 4 times a year, it's still important to realise that fecal worm egg counts can be very useful. If you perform them over the grazing season, they can still give an indication as to whether the animal, so whether the youngster is producing large amount of eggs, whether the worming therapy is being effective, and if there are any problems, those can be shown up very early. So don't think just because you're aiming to worm about 4 times for your youngster or your weanling that fecal worm egg counts are not going to be useful. They're just interpreted in a slightly different way. As always, asking your prescriber for specific advice is the way to go. In summary, the plan should be broken down to managing your pasture to minimise reinfection, and this really is the cornerstone of any worming protocol that we advise. The next is to use tests appropriately and regularly to be able to say whether there is likelihood of a worm burden or not, and to try and be more specific with which horses are going to be treated at any one time and which horses are not going to be treated. After we've done this, we can then plan a worm control program which takes into account all of the specific circumstances for that horse and that horse's individual needs. And only after we've done all of that can we decide which is the best wormer to dose with, which is most suitable, and which is the right time to dose it with. So that concludes the formal presentation that we're going to, that's tonight. As Ben said, we are going to try and see if we can answer some specific questions that you have. So I'll pass you back to Ben just to introduce any that we may have.
Hello. Okay, we have a couple of questions. The first one is, let's have a look. I have 2 donkeys in the same field with my 2 horses. What is the current recommended worming regime for the donkeys?
Okay, can you hear me okay, Ben?
I can hear you fine, yes.
Yeah, thank you. So donkeys they're traditionally quite hardy animals, and they won't show specific problems until they get very ill. What we sometimes find is that those, again, will be showing quite specific high burdens of redworm in particular. So I would encourage you to think about donkeys in the same way, to make sure that they're treated for tapeworm, but also to use worm egg count to identify identify when they're shedding large burdens of the small redworms in the same way as adult horses. So really think about them in a very similar sort of way and target them, because they can quite often be the ones that are developing quite a large amount of contamination to the pasture.
Okay, that's great. We've got another question here. Bear with me just 1 second. Yeah, if you're poo picking in a field, how long should the field or paddock be rested for?
So if you're poo picking, then horses can be in the field whilst you're poo picking, so you can have the horses in them all of the time. If you've got, say, if you're going to harrow that field, then resting it very much depends on the weather conditions, particularly if it's hot and dry, then worm and larvae eggs will not be able to develop in the same way. So resting isn't quite so applicable. If you're poo picking and you've got the right stocking density, then you should be able to graze throughout the season without too much of a concern.
Okay. One more question, I think. And it's just concerning, I don't know if you can answer this one, if droppings collected from pasture are composted in a high temperature with friable compost results, can larvae survive this process?
I think there's very little available information on that. I think you have to assume that they can survive some of that process because the droppings themselves are known to protect the larvae in some circumstances. And certainly I wouldn't advise then spreading that or putting that anywhere near where a horse can graze. So not a very specific answer, but I think it's a good question. I think you do still have to consider it once you've removed it from the actual pasture.
Marvellous. Okay, I think it's been a while, so I think we should end the webinar now. Thank you very much for everyone attending, and thank you, Wendy, for hosting that for us. And we'll hopefully have a new webinar soon, possibly about the encysted small red worm, and a little bit more about that, and precisely which wormies can target that, which drug groups, and really how to target that very dangerous worm. So thank you, everyone, and thank you, Wendy. And this is the end of the webinar. Thank you.
Thank you.